These are recommendations that need to be acted on to make our system more efficient and to ensure that Albertans are getting quality, accessible health care. Many of these are ongoing work that indeed dates back to work our government was doing, such as a better scheduling system, better oversight in home care, and making better use of our MRI and CT machines, and indeed the reform of procurement. But there are also recommendations here that are potentially very concerning. Recommendations that, if implemented without very careful thought and attention, could have serious consequences for patients, staff, and indeed all Albertans. There is potential within these recommendations to seriously impact the quality of patient care. The issues we currently have in our healthcare system were created by years of conservative meddling and mismanagement. What I fear from this government is a return to the PC era, where ministers of health did not take responsibility for healthcare. This minister says he won't close rural hospitals, but he won't be specific about what reconfiguration means. I imagine that's especially concerning to the 36 communities that have facilities that this report says are not viable. This report also calls for the closure or consolidation of air ambulance bases, which would also be of great concern to rural communities, particularly in the north. Or the 6 emergency departments and small community facilities that could potentially be on the chopping block. Minister Shandro and this government have made some significant promises that I'm not sure I trust them to follow through. We've seen Jason Kenney break so many already, including his public health guarantee. And indeed, we agree Albertans deserve to get good value for their dollar when it comes to health care. But let's be clear. There would be no need to look at cuts, Americanization, and layoffs if this government had not chosen to hand over $4.7 billion to big corporations, leaving less money for the health services that Albertans rely on.